Well, the Gauteng Health Department has now confirmed it has not yet received any forensic report from the SA Police Service following the fire at the Charlotte Maxeke hospital about 18 months ago. The department says that's despite the publication of parts of that report in the Daily Maverick website this morning, and it has still not received a copy. The investigation report by a senior SAPS officer says the cause of the fire at the hospital was arson. To put it another way, it seems that someone started a fire in a hospital during a pandemic. Mark Heywood is the person who published that report this morning. He's the editor at Citizen Maverick. Mark, good afternoon to you. You have seen this report. It seems to be very detailed. What does it actually say about the cause of this fire?
Good afternoon, Stephen, and thank you for having me. Let me just give a bit of background. The report is a report that was requested by the police in Hillbrow and is produced by a captain in the SAPS's forensic investigation unit who was brought in specifically to examine the causes of the fire. And what he found through his investigation was that the fire could not have been caused accidentally. In fact, he goes through a number of scenarios, accidental scenarios, and rules each one of them out. And following his finding that it couldn't have been caused accidentally, he then considers what he calls malicious human behavior as a possible cause. And basically, on the basis of a number of discrepancies in the investigation, what he was told by staff about where the fire started versus where it actually started, and a number of other factors, he says that the cause of the fire is arson, caused by deliberate incendiary action to set the storeroom alight, and he requests further investigation by the SAPS. His only job was really to determine the cause of the fire. He's not the investigating officer. It's not his job to follow up suspects and so on and so on. The last thing I would say, Stephen, is that this report was signed off in an affidavit by the captain on the 27th of August 2021, so more than a year ago. And really the big question that I haven't been able to get an answer to yet is what, if anything, the SAPS did to follow up on the investigation.
Why, I can't imagine, Mark, why someone would set a fire in a hospital, never mind during a pandemic. And I hate to say it, with all of the reporting we've seen from News 24 around a Tembisa hospital, is this about corruption? I can't get over this.
I can't get over it either, because as you said, during a pandemic, when the hospital was under enormous pressure, when the storeroom contained PPE, amongst other things, amongst 40 million rand of other medical equipment, I can only speculate, Stephen, but it seems almost certainly corruption. In this police report, there's talk about discrepancies in the stock taking in the storeroom. Could that be a factor? Could it have been deliberately set to cause damage that would then require reconstruction of the hospital that would then be tendered out at great profit to construction companies? We keep hearing a lot about the so-called construction mafia. There's a number of possible scenarios, but what did strike me about this report as I studied it was that there is ample leads. I would say probably 3 or 4 lines of inquiry that the police should have been looking into very, very seriously. And once you know it's not accidental, then you should be going down those roads.
The Gauteng provincial government released a statement today saying they haven't seen the report. I would have thought if I were the Gauteng Health Department and one of my biggest hospitals had been damaged by a fire and that there was a police report saying it was deliberate, I would want to get my hands on that report and I'd be calling the NPA asking for charges.
Well, that's what I would have thought as well. Remember that since that fire, doctors, nurses, activists have been continually asking questions about the cause of the fire. The Gauteng provincial government, the Premier, even the Minister of Health has been continually saying this is a priority, we're trying to get to the bottom of it, we are taking steps. So again, it feels strange, to say the least, that it's possible for journalists to obtain this report, but when I inquired from the Premier's office, and they were meant to be in charge of this, if they had seen the report. They said they had not seen the report. Yesterday they had not seen the report more than a year after it was produced. Again, just it makes no sense. This is not good governance of an asset upon which the lives of several million people are dependent.
Mark Heywood from Newzroom Afrika, thank you very much indeed, the editor there. An astonishing story.